and get started while people are continuing to join. If you didn't hear early, again, welcome to everyone. I'll reintroduce myself if you're just joining. My name is Wynette Dixon, and I am the Director of Programs and Strategy here at the eHealth Initiative, or eHIve. Today, we have a great panel lined up for you, but before we get to that, I just want to talk to you a little bit about eHIve, for those of you that are not familiar with us and what we do. We are a small but mighty nonprofit who is focused on healthcare transformation. And the way that we do that is through our membership. Today's session is on publishing prices, going beyond the spreadsheet, price transparency. Few housekeeping rules. Please submit all your questions to the Q&A box. If there's a question that you see that you like, you can upvote it by hitting the thumbs up, and that will put your question to the top of the list, and we'll make sure that we get to it. We often don't have time to get all the questions, but we will try to get to as many as possible. If we don't have your question answered, don't feel bad. We will leave some follow-up information so you can follow up later. Today's agenda, we have a great panel that's talking about price transparency. It's really not going anywhere. And it's a good thing for everybody, but there are some questions and implications. And so we're going to talk about the regulations a little bit. We're not going to go too much into detail because we did a webinar on that in June. And if you'd like to look at that webinar again, it was June 29th. You can go to our website and check it out, and Sarah will put it in the chat. We'll also talk about the impact on providers and the challenges and scoping and management of implementing this new workflow. And then we'll go to questions from the audience, and we'll have some closing remarks from our panelists. So about eHIve. As I said, we are a catalyst for healthcare transformation, and we bring together a number of leaders across industries to collaborate. Our focus is real on education, thought leadership, and advocacy. And through all the work that we do collaboratively, we really believe in the transformation of healthcare through partnership. That is our mission, and that's what drives us every day. This is a few of our members. It's a lot of members, but these are just a few of our members. If you don't see yourself here and you're interested in membership, please email info@ehidc.org for more information. We are in 4 primary focus areas: social determinants of health, which has been a very hot topic over the past year and a half and will continue to be so as we go forward. Consumer privacy of health data. We focus a lot on non-HIPAA covered data. Virtual care. I think everyone right now is very aware and very comfortable in probably using virtual care, especially in light of COVID-19, which now takes us into COVID-19 best practices and innovation. Those are the areas that we continue to focus on. And if there's anything that you would like us to present or any topic of interest, please go ahead and put it in the chat, and we will take your consideration. These are some of the reports that we've released recently. Our most recent report, as I stated earlier, if you weren't on, was on cybersecurity and looking at some of the challenges in the framework. All of these reports are on our resource center, again, at www.ehidc.org. We have a Digital Health Equity Summit coming up November 3rd and 4th. If you haven't registered, please do so. We've got more than 1,300 people already registered. It's 2 days of a great agenda. We really cover every aspect of digital health equity. And so I encourage you to register. It is free. You can check out the agenda. All of that is on our website. And now I'd like to introduce our speakers. I am, again, your moderator. Today, we're joined by Ruby Raley, the Vice President for Health at Axway, and also Dr. Andrews Carlson. He's the Medical Director of Clinical Content at Zipnosis. We also have Jeff Ubben, the Vice President for Compliance, Regulatory Affairs, and Special Investigations, that's a mouthful, at Blue Cross Blue Shield of North Dakota. And he will also be presenting with Eric Holmberg, Director of Digital Delivery at Blue Cross Blue Shield of North Dakota. I want to say thank you to the panelists for agreeing to join us today and to talk about this important topic. And if you don't know about price transparency, I will just give you a quick overview and tell you that it's the ability for you, the consumer, to access information on the price of healthcare services. This is such an important topic because this really impacts not only the patients, but also the providers and the payers. And with all these regulations, I think there are more questions than answers. And so today we're hoping to answer some of these questions and address some of the concerns that people have. And so with that, I'd like to invite Ruby who's also, oh, I'm sorry, I almost got to thank the sponsor, Ruby Rayleigh from Axway, who will be talking to us first, and also give her thanks as the sponsor for this program. Without sponsorship from companies like hers, it's virtually impossible for us to put on programs like this for you, and it is our pleasure to do so. Ruby, welcome.
Thank you, Anne. You know, it's our pleasure to be on any EHI presentation. I always think our conversations are just sparkling. So looking forward to the opportunity to have another good conversation. I really would also like to thank the other panelists for joining us. We know they had a busy day. Taking time out is always super helpful for all of us so that we can share viewpoints.
Thank you. I'm looking for a sparkly conversation too.
Yeah. Yes. So, you know, let's start with what a lot of people consider a confusing mess, which is the regulatory world that we all stepped into with the interoperability rule, which affects both providers and health plans. And even pharmaceutical companies like pharmaceutical benefits managers. And many of us are looking at these FHIR APIs and requirements to expose prices or to work together on the No Surprises Act to give a patient an estimate before they go in for a procedure. And we look at it as just a big pile of things that we have to tackle. And we're going to tackle them one at a time. But I'd like to ask us to consider if it's an opportunity, because we're now in this almost fully digital world, depending on where COVID seems to be the worst, and digital experiences could really make a difference for patients and members and third parties of all different sorts. And if we think about it that way, I think we could actually not just comply, but build something great. But what I do recognize is that there's just not enough time between when these APIs come online and the time it takes to spin a team up, understand the requirements, work with our partners, build it out, test it, and get it put into production. And so I want to have a little bit of a conversation about how we might think about it that would enable us to think of it more from a reflect and reuse point of view. And if you would go to the next slide, 1A. Thank you. So let's just take the interoperability rule to get started. It just laying across the top, the little Lego blocks are the patient access FHIR API. So that's the patient can download his records. The provider access API is where the provider can download his patient's records. The payer-to-payer access is where two payers can share all of the data associated with one patient when that patient is moving their membership from one plan to another. And then we have a provider directory API and a prior auth API. Now, the provider directory API and the patient access API are already mandated by law to be available to third-party developers. But others APIs, like the payer-to-payer has been delayed, the prior auth is not yet available. So we still have some time to think about these. And what I'd like to challenge you is, if you thought about this from a standpoint of reuse, you might say, well, if I build one FHIR API that grabs member data or patient data, I could actually solve 3 regulatory requirements: the patient access, the provider access, and the payer-to-payer. And I could do that either with versioning or parameters or security type redaction or blocking. So it's really interesting to think about that. So I think if we stopped building our Legos one block at a time in a sequential order, we could think about this from 2 points of view. And the first being like using design first thinking. Some people call this API first. You read a lot about this, about Bezos mandating years ago that every piece of technology in Amazon had to have an API on it. And by doing that, later they found they could do things really quickly because they already had all the hooks built in. So, but if you use this design first thinking, it helps you think about how your API will be used by others. And if you did that, you might soon see that the patient member data API really has the same kind of data in it that the provider needs and the payers need. And so that might help you. It might also help you think about how you construct your portal, how you engage these people. And if you think about, well, if I'm going to start with the patient data, the patient access API, oh, well, then in a few months, I'm going to need the provider, and then I'm going to need the payer to payer. You could think about, I'm going to go through a series of change. That might actually help you find a way to eliminate duplicative work or be more efficient. And as you think about APIs, like we need to think about using APIs to black box functionality. And what I mean by that is to hide the complexity of what's behind something so that with one interface, we go fetch something. And if we think about it that way, we could start with an API that fetched some data. We could realize we needed more data. We could version that API and actually put an API up that had the additional data, retain the old one, and then gradually migrate through so that we don't have to do massive force people to stop using something, start using something else, retire something. We can think of it as a life cycle. And we black boxed it to minimize the effect on all the things around us. And we start thinking about how things change over time so that we can try to anticipate and plan for reuse. And then APIs themselves allow us to put things together in building blocks. So another way to think about this is there could be a core API that pulls data from your internal repository, a core API that pulls data from your pharmacy benefit manager, and then an API that merges that data together to deliver to the patient. So in that way, by putting the blocks together, you begin to get to the complete answer without it being so monolithic. Next slide, please. And so that takes us to one of the things Gartner's been talking about. And as a technologist, of course, I follow Gartner and Forrester, and they're both talking about this idea of a composable ecosystem and low-code way where we have a set of components and we can put them together to actually deliver services faster to our partners, our internal business leaders, and our customers, whether they're patients or members. And so if we think about changing compliance from an 18-month or 6-month project sprint to a composable ecosystem of built components, we might then be able to actually get to that advanced explanation of benefit or price estimator faster. So let's kind of decompose that a little bit. So if you took that, you could see that an explanation of benefits is tied to a procedure. So you're going to need something like a prior auth, which, oh yeah, I had to build a prior auth. Well, maybe I could reuse that prior auth for the facility or the doctor, the provider, to request me to come up with the cost estimation. I have to have all my prices and contracts exposed. What if I had done that with APIs instead of with spreadsheets? Oh, I got to have a provider directory because I have to know who's in network and out of network so I can get the right price. I have one of those. I did it for the interoperability rule. Maybe I just add a field to it. Maybe I already had that field because I thought ahead. Oh, maybe I want to add some value to my members and I want to show them what their health savings accounts balance is. You know what? I already have that on my member portal. I can reuse that. Or I need some additional decision support because my provider's not going to know everything they need to give me to help figure out what the cost of the procedure is. You know what? I had to do that as part of the interoperability rule too. I can reuse that. So if the provider needs extra questions, he has a query function already built, ready to go. oh, and I need to get the drug pricing for the advanced explanation of benefits. And I have that because I had to go get my pharmacy benefit prices as part of exposing the patient records. So now I can just expand on that to pull that drug pricing or the formulary information forward. So if I don't think of the explanation of benefits price estimator as this monolithic new product that I have to build everything from scratch, and I think about it as composing a new experience for my member by using things I already have or adapting the things I already have, maybe I can reduce the cost, complexity, and time to comply with these compliance, and I can ensure that everything is kind of self-referencing. And so, you know, on the far right, I just put a few thought questions, which we don't have to go through today because I want to hear what the panelists have to say. But as we go through all of these efforts, I just think we have so much opportunity to transform how we work with our partners, our provider-payer relationships, our patient relationships, our relationships with our third parties. Like, there's a lot of opportunity here that could help drive a more informed patient or could help change your portal into a competitive advantage by making you easier to do business with or making it less frustrating to deal with healthcare finances, and taking advantage of some of these public prices to learn more about your competitors.
Thank
So
you,
Juane,
Ruby.
yeah, that's kind of setting the stage, I think, for our conversation. So
Absolutely. Thank you for that. I think that, you know, really the high level takeaway from that is behind the scenes, there's so many things that have to go on. And there's so many things that have to happen, so many moving pieces that the patients aren't often aren't aware of, you know, with the formulary and the drug pricing and, you know, how does this with the prior auth and like, you know, all these things that go into it. So hopefully, I think giving that technical overview, I think was very, very helpful. Thank you. It really just lays out how complicated it is on the back end, but it also shows the dedication to IT companies to make sure that this happens and that people are thinking about it and, you know, they are being responsive. And so patients don't have to see all this on the front end. You know, the end result is they will be more informed patients, you know, and they will have access to pricing in a way that they've never had it before. So I thank you. Thank you so much, Ruby. Okay. With that, I'd like to invite Dr. Anders Carlson to join us from Zipnosis. Hi, Anders, how are you?
Good, how are you?
Good, thank you. Welcome, welcome. Please tell us from your perspective and your experience, how is this price transparency going to affect all of us?
Yeah, thanks. And first, just let me say thanks to Juane and EHI for the invitation to be here and with such a great panel. I'm looking forward to the discussion. The way I see it, so I've been in clinical practice for over a decade as an endocrinologist and diabetologist before joining Zipnosis and now Doc Squad. And I really see this more from the patient and provider perspective. And I think as Ruby mentioned, there's a lot of uncertainty, but a lot of opportunity built into the price transparency. And I think, you know, when I think about this broadly, I think of it impacting us in three kind of general categories. The first is obviously patient choice. That's something that's really been lacking up until recently. I think we really saw in COVID, in particular, that patients liked having the option of being seen remotely or having the option of sending an email message into us or sending a picture in through the electronic medical record for our interpretation and recommendations. So there's a great opportunity here for patient choice. Now, you know, giving them the tools to see the prices, to know exactly what to expect going into it, they might make different decisions about, well, this is something I think I can just address with a virtual visit or an e-consult, or, you know what, wow, I had no idea that, you know, taking my kid in to have their, to have their pink eye looked at in urgent care is going to be, you know, so much more than just doing a video visit. So I think empowering patients with that choice is going to be really, really crucial to seeing this take off and really succeed. I think the second aspect of this is going to be in health equity. Again, in the pandemic, we really learned that, wow, there are patients who, who work shifts or can't leave their work, or, I've had patients who work overnight and then to come see me for a 15-minute visit during the daytime, they have to take a full day off of their work plus see me in the middle of what's their night. And so, having that that equity, for people who can't take time off, or, I've worked in clinics that aren't on public transportation lines, where video visits would have been so much more beneficial to their care, or rural patients. I think there's a huge opportunity here to deliver quality care in a real-time fashion to people who maybe wouldn't have had access to it before, and who, having the ability to say, oh, wow, that type of benefit is covered, or I can actually see my primary care doctor in this way or that way for cheaper, will be really useful with the transparency rules. And then finally, I think it's an opportunity to really strengthen the patient-provider relationship. And I mean that in sort of a precision medicine way. When we see a patient, you're talking to them, you're trying to listen and hear and read where they've been and what they need. And when you try to come up with a plan with them, it's really hard in the current sphere to say, well, here are 4 things that I think you might benefit from. I have no idea what they cost or what's covered or where you're at with your deductible, or your plan is changing in January, so I have no idea. Let's just pick one of them and see what happens, and then we'll take it from there. That's not really giving our patient the personalized, individual attention that I think they deserve. So with this, and this is a hope of mine, and also it's a challenge of this process, is to have it integrated ideally into the electronic medical record, where I can say, we've had our discussion. Here are the 4 things I think you would benefit from. Let's take a look. Looks like 2 of them, will cost this much. The other 2 might be a little bit different. And then you can have a pro and con discussion about, well, I think option 1 would be okay, but if if option 2 is a little less expensive, here are the, a couple of things I would want you to think about if we go that direction. And that can all happen in real time or in near real time during a visit. The idea of prior authorizations, I think, is a little bit of a misnomer. To me and to a patient, there's nothing prior about a prior authorization, right? It's taking place after we've decided what steps we want to take. I want you to start this medication. I think that's the best for you. I think you'll have the best outcomes for you. We've already decided on it. Waiting on something now to be authorized is just taking that bond and that connection that I've developed with the patient out of reach a little bit, and not really giving us the feedback and the information we need to really make informed decisions. Now, there is some data that different price transparency tools have been implemented at different care systems, and they haven't really impacted things one way or the other in terms of either patient choice or patient satisfaction. So I think it's important, as this gets rolled out, to really think about what that interface is and how we can roll it out in a way that just isn't, here's another price tool, good luck, and and let me know if you have any problems with it. I think, as Ruby said, this is really an opportunity to empower our patients, even to kind of really have them establish some connection and some identity and brand recognition with your clinic. Why would patients choose to come see my center or my department when they could go across town? What are the things that set you apart? And so this is just giving that extra layer of information to the patient coming into the visit. And I'll add that providers are very busy. That you have quick visits. There's very limited time. The demands are pretty high. So I think there are challenges for sure, and we'll probably get into some of them. To the provider about how this gets integrated into their workflow, because that's a big question mark to me. So I think there's a lot of opportunity here, but also definitely some obstacles.
Thank you. I really like the way you frame that, especially health equity. It really stuck out to me, because I think the reality is that people today make decisions on their care based on what they can afford, and also based on what they anticipate they can afford. You know, I have a son, he has multiple doctors that are part of his care team. And there have been times where I have to decide, maybe we'll put this one off. You know, I have to ask, is this really urgent, or is this just kind of like a follow-up, you know? And I'm talking about big ticket items like MRIs and, you know, CAT scans and things like that, you know? And I think, you know, that's the reality for so many people, is that, you know, they really have to often make that choice, especially when, you know, when there's so many like economical differences between people. You have to make that choice between, you know, how sick am I going to be before I see the doctor? How much is this going to cost me? You know, parents have to make that decision for their kids. You often have to make that decision for parents. So I think this really is an opportunity, like you said, to empower the patients. And I think that's so important, because through empowering the patient, like you said, we'll achieve, you know, that health equity, which is really what we want: equitable healthcare for all in terms of access and affordability, and also I think awareness. This is an opportunity to level the playing field, you know, and let patients know these are your choices. You know, you're no longer at the mercy of what the health system is offering you. You have options, you can ask questions, and you do have choices. So you're not participating in your care. I really love this. It was really great. And I think patient choices is probably the most important benefit that comes out of it. And there are lots of other opportunities. And I'm looking forward to asking some of those questions as we get into our panel discussion. Thank you so much for that, Anders. This was great. Now I'm going to invite our two gentlemen from Blue Cross Blue Shield North Dakota, Jeff and Eric, to come join us. Jeff, are you up first, or are you and Eric? I'll let you go first. Okay.
Yeah, I'll go first. I think you want to. So my name is Jeff Ubben. I'm Vice President of Compliance for Blue Cross Blue Shield North Dakota. So I am obviously a regulatory compliance guy, so I'm going to be talking about compliance efforts and some of the challenges and opportunities we as a health insurance company have faced from that perspective. But I also have my colleague Eric Holmberg with me today. Eric is our Director of IT Solutions Delivery, and he'll be providing his viewpoints as well. So I'm excited to talk a little bit about the new price transparency regulations, because I really believe they will be transformative for our industry. Now is an opportune time, I think, to explore not only the challenges that comes with meeting the requirements of these regulations, but also to take a good look at the opportunities that these regulations provide. Needless to say, I think the coordination efforts that will need to occur between payers, providers, and patients will be critical in optimizing the objectives and the opportunities that these regulations provide. So I think most of us will acknowledge that price transparency in healthcare in this country has traditionally been an area that has been lacking and is in need of improvement. And in my position in particular, I handle complaints and grievances from our membership, and matters relating to price transparency or the lack thereof frequently make up the subject matter of many of the complaints and grievances that I receive from our membership. So first of all, a few comments on the challenges we as a health plan have faced with implementing these new regulations. The price transparency regulations in and of themselves present a challenge for a smaller health plan like ours with limited resources to timely implement and make compliance. And this effort has been even more challenging for us, considering that the price transparency regs have come in the middle of a flurry of other healthcare related regulations, such as the Interoperability Rule and the Consolidated Appropriations Act. So our ability to think strategically about the opportunities of the price transparency regs was strained a little bit by the heavy lift that has come with trying to fully understand everything that is required by the newly enacted regulations, and by the sizable effort that has come with the work involved in meeting timely compliance with all of the new regulations essentially simultaneously. So in the early stages of working on implementation and compliance, we as a health plan made the decision to focus our resources on achieving timely compliance with the regulations. And that was a decision that was mostly made out of necessity, as I believe we would have been at risk of not making timely compliance with the regulations had we not made the decision to focus our resources initially on making compliance. One particular challenge that we've found is that the work needed to implement the provisions of these regulations at the company has fallen on the same subject matter experts within our company. So in other words, I've been unable to spread out the work across the company or to divert it to other resources as much as I would have liked. These same resources are continually being strained by all of the work involved here. Budgeting for the implementation work has also been challenging. If you recall, the Consolidated Appropriations Act, which includes the No Surprises Act, was passed on December 27th of last year. And a lot of the implementation deadlines that were present in the CAA and the No Surprises Act were January 1st of 2022, which essentially meant we had the calendar year of 2021 to carry out the implementation work. So one major challenge with this timing is our 2021 budgets were already set and approved by the time this legislation was passed very late in 2020, and therefore we did not have the resources specifically budgeted to perform the work associated with what has really turned out to be one of the largest projects our company has had to take on in recent memory. So we've had to be agile, creative, and strategic really in how we've worked in order to make sure the necessary resources were in place to ensure timely compliance. However, we as a company are now at a point where we're able to look at these regulations also with a strategic mindset as opposed to just a compliance mindset. And that's very important. Because one major opportunity that we've identified really is the opportunity to improve our customer experience and our customer satisfaction. No one likes receiving a larger than expected bill or a surprise bill after receiving medical care. That type of experience is obviously not a catalyst for driving positive member experience with a health insurance company. And as I mentioned earlier, it's been the leading cause of member dissatisfaction with our health plan. So we really have looked for ways to strategically incorporate the requirements of the price transparency regulations, and along with some of the other recently enacted regulations that I mentioned earlier, really with the goal of providing our customers with an improved experience. So admittedly, we are in the early stages of this work, and I certainly don't have all the answers today for how we are going to turn our vision of an improved customer experience into reality. But again, we are viewing this as an opportunity to take this regulatory compliance work and really turn it into something that will hopefully improve our product, our company, and enhance the services our customers received. I also mentioned previously the importance of the coordination efforts that will need to occur between payers and providers and other stakeholders in the healthcare ecosystem. I think in order to optimize our customers' experience, there's going to need to be very strong relationships between those parties and open lines of communications, especially between payers and providers. And to that end, we have made an effort recently to reach out to our provider community and enhance our relationships with them with the hope that we will be able to work together to meet the challenges and opportunities presented by these regulations. For example, in order to provide a timely and accurate advanced explanation of benefits and customer cost expectation to our customers, say, for example, a scheduled knee replacement surgery, it will be necessary for us to have open lines of communication with the provider so that we are able to know all of the services the provider anticipates providing to the patient during the procedure. Really, our estimates of the cost associated with the procedure will only be as good as the information that providers give us regarding the service or services the provider intends to provide. Now, certainly we anticipate the providers will not always have a comprehensive list of all the services that will actually need to be provided to a patient during a procedure prior to the procedure being formed. So I believe we as a health plan will need to manage expectations accordingly with patients. And finally, I just wanted to touch briefly on the new requirement for health insurance companies to publish our fee schedules or prices with providers. I think there will likely be some analytics work performed by health insurance companies on pricing files to really understand where each company stands with payments and payment amounts compared to other payers in the marketplace. So we'll likely expect some analysis amongst the nation's health insurance companies about each other's pricing models, the results of which I think will likely have an impact on the provider contracting work that we do to some degree. So with that, I'll turn it over to my colleague, Eric Holmberg, and invite him to add his viewpoint into the discussion today.
Sure. Thanks, Jeff. And I'm keeping a very close eye on the time, so we have enough time for discussion amongst the panelists and answer some questions here. But you know, from a technology delivery perspective, we've really been focusing on what Ruby touched on to kick it off in developing APIs that we can reuse to make these implementations go a little bit quicker, right? As we found with payer to payer and some other things, the government isn't necessarily completely set on what they want to do or how they're going to do it, right? So we have to be prepared to pivot. And building reusable and composable architectures and technologies that support these initiatives is very key for us. And utilizing APIs is really the way that we're looking at it. You know, it's been a great, I'm going to say this a little tongue in cheek, but a great experience. You know, Jeff and I have become fast friends, the friends that we never knew we were going to be through this process. And you know, it's been real eye-opening to engage and run at the speed of the federal government and the interoperability mandates to be able to implement, make those dates, and put in the appropriate technologies to support those initiatives, both short-term and long-term. You know, it's hard when rules are changing and you're up against the deadline to go, okay, how do I just get to the finish line, but yet knowing you still have a marathon in front of you. So, you know, we've really been trying to do that to the best of our ability from a technology delivery perspective. So with that, Juanita, I think I'll try to leave us a significant amount of time for questions and answers here.
Thank you. I'd like to invite all of my panelists to join me. And first of all, say thank you for, I think they've really laid out this conversation from very different perspectives, which really lends to the 360-degree approach you have to have with just, you know, with price transparency. You know, we've looked at it from a technical perspective, a compliance perspective, a clinical perspective, you know, and I'll represent the patients here, as I have a few thoughts on this as well. So there really, you know, this really is, there's a lot, and I think I'm hearing from everyone. You know, we've talked about like the challenges and the opportunities. Now I'm going to put on like my old project management hat and think about like a SWOT analysis, right? So we've talked about our strengths and opportunities. So what are you seeing as like weaknesses with this? Are there any that come to mind that should be of, you know, that are of concern that you're thinking about or that you're actively addressing? Who wants to take that out?
I'm gonna jump in because we've got a couple of questions about data standardization and Da Vinci Group standards and stuff, and that goes with what Eric was just saying. You know, there are some of the FHIR APIs that actually have the implementation guides well documented and FHIR standards exist, and some of them are just candidates. And yes, groups like the Da Vinci Group are super helpful. Like I know Jocelyn, I suspect the EHI team does as well. And it's really important to follow them. But if you wait for the model to be developed, the candidate to be proposed to the community and voted on, you're going to have no time left in the schedule. So I think that data standardization would be helpful, and the lack of it is going to make folks like Eric have to do things over a couple of times when they wouldn't have had to. But unfortunately, with the dates out there, you're going to have to dig in. And I really think that there are many people in the healthcare ecosystem or on all sides of the equation who really don't know much about all the data elements that move back and forth between payers and providers. So I think if you don't dig in, you won't be able to challenge and ask the right questions. So I know that was a long-winded answer, but that data standardization is super important, but we just don't have it.
Excellent, thank you. Andrew's like you were going to say something.
Yeah, I think, you know, one of the challenges for sure will be the accuracy and the real-time nature of it, because unless, and that kind of has to do with the standardization, unless we really know with some degree of certainty that the information we're giving the patient that's coming to us directly in the EHR is accurate, you know, we might just kind of blow it off, and then it does become just another administrative burden, another box that I need to click to get out of, without paying too much attention to. And I think, I know the time windows are tight, but the time window to build trust is also really tight. If this doesn't work, right away for both on the patient side and the provider side, where it's not going to get used all that much, or used as intended and hoped it could be used. So I think really having accurate, up-to-date information is going to be key. With the caveat too that coverage isn't always the same as cost. Something, the data needs to not only be, is this covered by my plan, or what does my formulary say? Your formulary might say that $1,000 a month drug is covered, but that might only be covered at 50%, 40%, and that just makes it then not usable. So although it's covered, it's not convenient or affordable to every patient. Plus, it has to factor in deductibles and all that other stuff. So it's a lot of information that needs to be really accurate if we're going to use it as it's hoped for.
Yeah, and Anders, this is Eric. From a provider perspective, jumping in with my own questions here, like I'm not.
Please.
From a provider perspective, are you would you be concerned with, especially with price transparency, that patients may do sort of avoidance of procedures based on that cost? Where they're like, what, this is maybe just too expensive and I'm just not going to do it, and maybe put themselves in further risk just based on that. So, like, I'll let you answer in a second, but I get that, kind of the point of, hey, we want to make sure that people know, but sometimes when people know, they really know, and it may adversely affect how they approach their personal care. So I'll let you answer there.
Yeah, no, I think, thanks, Eric, for that question. I think that's exactly the elephant in the room. How will this impact patient decisions in a positive way, we hope, negatively? I think that's sort of where we as a community need to kind of address this too. Does something, for instance, how well are we covering preventive cares, or are we covering the next step? Let's say a patient gets a MRI that needs follow-up. Okay, well, when are they just going online and seeing that the next step is just too prohibitive? Do they have anyone to help them navigate that? We're going to really need to lean on some of our, clinical advocates, patient advocates, administrative staff. I will tell you that, as physicians and clinicians, for that matter, we're not trained that well in the financial, cost and regulatory piece of things. That's just not part of med school curriculum. It's really not until you're in practice that you learn how to do billing whatsoever. I mean, that's not just really taught, and for good reasons and bad. I mean, I think, the idea is just to kind of make yourself agnostic to the different, companies and therapies and devices and so on. But that's just not, that it's just sort of, that horse has left the barn, so to speak. I mean, that's not the case anymore. Patients can find that information out very quickly. They're, like you said, they're calling you with, concerned about surprise bills, and, they're calling me about those surprise bills too. And we don't know that on the provider end. So yeah, I have absolutely a concern.
That was actually going to be my follow-up question, because thinking about like underrepresented communities, but then you also made a point about physician burden, and what this means to like the workflow and the additional administrative steps that have to be taken now to make sure that you're meeting your regulatory requirements and you're staying compliant. I'm wondering so what's the timeline like when we're talking about price transparency, and someone made a mention earlier, like the provider has to give information about what the next steps are. What are we talking about in terms of time? Because this doesn't sound like I go to the doctor today at 3 o'clock and I see this is what everything's going to cost me. That's not what this sounds like to me. So what is actually happening? And how long can we expect all this information with interoperability? Like, I mean, really, Eric or Jeff, I'll ask you, like, how long does it really take or how long should a patient expect to expect, that information to be available? And with so much data available, how do you pull that all together in a way that makes sense for the patient and is sort of meeting their needs in terms of this from a client perspective, compliance and technical perspective?
Yeah, that's a good question. So recently the federal government delayed enforcement of the price, a lot of the price transparency regulations to January 1st of 2023. It had been January 1st of 2022, but Present in that regulation is that plans would have to provide this information to patients. So if the request is less than 10 days to the date of service, we have 1 business day to provide the advanced explanation, benefits, and cost estimate to members. Yeah, if the request is more than 10 days out to the date of service, then we had 3 business days to provide it to the consumer. And again, it's going to be very challenging for us, which is where our relationship with providers and open lines of communication, I think, will really be key.
Wow.
I'll just chime in that this is that Anders and Jeff have put their finger on some of the transformative things here. In today's world, there's usually some back and forth between the provider and the plan on prior auth. And again, Anders, I love your statement that prior auth is after I and the patient have decided to take action for an encounter or a procedure. It's not really before. So maybe telemedicine has more value here than I ever realized. You've given me some really new perspective about how telemedicine might become care navigation for us. But that back and forth is a slow process. There's no way, and I'm sure Jeff would support me in this, that prior auth typically occurs within 1 day in today's world. Is that a correct statement, Jeff?
Yeah, it's a challenge.
Right. So, like, if we can comply, then everything's going to be different. And that's like one of my messages is we're touching everything in the chain in healthcare, and we've never done that before. I mean, certainly the adoption of the EMR standards with the HITECH Act was huge burden on doctors and facilities and clinics. But now we're impacting the entire eligibility claims adjudication processes, right? Because the No Surprises Act said the plan has to honor the price it gave you. So this is just huge. And that's why I love what what Jeff said about, the delay and how North Dakota has been moving from just responsiveness to compliance to now taking a breath and thinking, because there's a ripple effect on all of this. Anders talked about some of it with trust. If this is just sloppy data, I'm just going to park it. I'm not going to pollute my health records with your sloppy data, which is one of the things that no one ever talks about, but it's always been the barrier in interoperability, is if you don't trust the data, you're not going to import it. It's just going to be parked in a PDF somewhere. And then to Jeff's point of view, like, how is all this going to work for a plan? Like, how can we move that fast? How many people are involved? I don't have the teams. How am I going to address this? What am I going to standardize in order to go faster? What do I give up if I do that? Where are the unintended consequences that bite me? Eric and I both dealt with that in the first 6 months of this year, like things we didn't think were going to be a problem. All of a sudden, Eric and I are on calls trying to figure out how to solve them. This is why I keep saying we have to start thinking about planning for change. And I don't have the answers. I just have the worries.
I think there's a lot of worries. It's actually a very interesting comment in the chat about, from the patient perspective, about also this encouraging providers, if you will, to sort of, think twice about what they're recommending, and think about like alternatives, because now the patients, do have the choice, or they'll be more involved in the choice, if you will. And there's a different set of criteria. It's a really great comment in the chat that who put that in there, that Hannah Ward. Thank you, Hannah. I didn't mean to call you out, but it's a really great comment about that. And I think she's absolutely right that, this is a time, it's not wrong that it impacts patients' decisions. I think that as patients, there should be more of that. Recognizing the sort of technical burden and how much has to happen behind the scenes. It's kind of like and seeing all of the, the health stakeholders that really have to come together to really make it happen and be successful. So we're about 10 minutes out. So I just want to start kind of winding us down. I've heard like 3 kind of main themes in this discussion, right? And it's really around, and forgive the alliteration, but it always works for me. It's really about engaging engaging the partners, payers and providers need to like engage one another, engage the patients, empower the patients, so that they can now make their decisions. And then educate not only patients, but educate the providers as well. It sounds like there's an opportunity for education on, on both sides. And I think with those, if we keep those sort of three goals in mind, to engage, empower, and educate, this, at least it takes away a little bit of the sting of change, because change is very difficult. The US healthcare system is already difficult by nature. For whatever reason, it could be simplified in so many ways. My background is global health, and it's a much simpler health system. You go to the clinic, you get served, you pay money, and that's it, right? The US is way more complicated than that. And I think that's kind of turned people off a little bit too. They're not quite sure, where to direct their trust, or where to even direct their mistrust, and then you have this introduction of telehealth tools and digital tools. And I imagine with telehealth that there's now a new price structure. And I'm wondering if anybody's even thinking about that. Ruby, Eric, Jeff, Anders, have any of you thought about because there was already kind of a hustle and tussle about, reimbursement for telehealth services. And I'm not sure that we've actually answered that, solved that part of it yet. But now we're in this age of telehealth. So what does this mean for telehealth services and even a hybrid model of care? What does that mean? Mm-hmm.
Yeah, I can take that. I think what we've really seen, with the public health emergency being extended is that, I think reading the writing on the wall that video visits and telehealth is here to stay. I don't think we're going back to the days of not being able to have an asynchronous visit with your provider or anything like that. I think this is here to stay. But I think what you're saying is true. Are we going to be more in a hybrid model? I know some health systems are saying, to their primary care providers, you're going to have a third of your visits be video visits from now on, or you're going to have a day a week that you're doing video visits integrated into your clinic, or some version of that. So I think it's here to stay. But you're right. It's a huge challenge. And I think from at least from the provider perspective, I like what you said about the education. I think it's going to be really key that we kind of assume that the providers really don't know a whole lot about this going on behind the scenes, and to bring them up to speed just as much as we're trying to educate the patients and the customers on that end. The providers will be really key in that piece. And I think there's an opportunity here to innovate. So what are, now we have this a little extra, we have some extra burden on the provider for, price transparency. Okay, what else can we do to remove a burden somewhere else? Can we automate their documentation? Can we automate some of this, get rid of the prior authorizations or reduce those? Those are a huge time burden. So are there some ways that we can at least, maybe add a little bit here and remove a little bit over there? And I think that's really where telehealth, telemedicine, automated things like that we're working on can really streamline the process.
Sounds good. Jeff, I want to ask you from a compliance perspective, what's on the payer side to ensure compliance, and what are sort of these, the measurements or the evaluations in place? How are you? I know it hasn't gone into full effect and it won't go to 2023, but I'm just wondering, like, what kind of framework do you have that protects the patients to ensure that payers are being compliant with this?
Yeah, so we're building the infrastructure out. Eric and his team have kind of led the effort. I'm certainly not the subject matter expert in that regard, but I think we are starting to get our minds around how do we use our resources strategically to not only meet the mandates or the regulations from price transparency, but also weave in interoperability and the No Surprises Act and items like that. Kind of a comprehensive strategic plan to make sure that we are able to provide our membership with a reasonable expectation of what it's going to cost to receive care. And admittedly, we're not there yet. We do work on the front end, and we can work with the provider's office to provide cost estimates, but it's not as seamless as we'd like it to be. These regulations, I think, have forced us, along with other payers, to really try to coordinate the efforts here and put some real resources into making positive changes in this area, so that folks actually know what they're expecting or can have more information and make an educated decision about what they're getting into prior to having a procedure performed. So while the regulations aren't in place yet, they're coming, and so we are continually trying to make ourselves better and continually working on kind of meeting the standards that have been set by these regulations. And plus, again, I just think it's good. It's a good business decision on our part to try to improve our member experience, and we should want to really help our consumers and our membership out to make sure that they're not being stuck with a surprise bill or with a larger than expected bill.
Yeah, it's sort of forcing the hand on changing the way you analyze the data that you have, right? We're now starting to gather different types of data. We're putting it together in a different way. And there's going to be a lot of data analysis, a lot of data scientists digging into this to help, as we're all talking about making this a strategic differentiator, either from a provider or a payer perspective, or heck, even a regular consumer or patient perspective, right? Mm-hmm. If I all of a sudden have access to all this data, right, I can go to all the different providers and the different health systems that are in my area, and I can now download and I can go, okay, geez, Ruby charges me $1,000 for this, Anders charges me $1,500 for that, but good grief, Jeff only charges me $700 for this, right? So if I'm looking at it from a cost perspective, right, I can now then put on my consumer hat in that perspective and go, hey, maybe I'll go talk to Jeff and make sure he's not operating out of the back of his van somewhere in an alley, but find a reputable well-priced provider to help me. So it just proves sort of the point of more data analysis, with how we're approaching this, and what we're going to be able to do with that to improve the experience all around.
Absolutely, thank you. So we have about 2 minutes left. I want to give all of you the opportunity to sort of make last comments on price transparency and where we're going. We talked a lot about opportunities and what it means on both sides.
Yeah. Hey, thanks.
That's my patient. Apologize.
Yeah. Thanks, Wanae. I'll take that. I'll take it from here. For my point of view is, I think the conversation really did exactly what I had hoped we could do, which is lay out some of the complexities and challenges, but also talk about the transformative opportunities and how each of us have a totally different point of view about the problem from where we sit in the ecosystem, and how if we pull all of these points of view together, I think we're going to be able to achieve some great things. I love what Jeff said about reaching out to the providers. I love Anders thinking about telemedicine could serve other functions like helping care navigation, helping make care decisions, help coordinate that so that it doesn't take up a doctor's time in an office where maybe a sicker patient needs to be seen. And Eric thinking about strategically about the data and how the data is moving and where data is going to be high velocity and where it's just really high volume and is challenging. These are all like really great things that are happening. And it's forums like this where we can put these thoughts together and see other points of view that I think are going to give us insight into how to solve it.
Excellent. Thank you, Ruby. We are actually, it's now 2 o'clock. The hour went so fast. This was such a great conversation. We really dug really deep into it. I want to say thank you to the panelists for joining us today. And I want to say thank you to the audience for the questions that have come through and for also to attending. And we will be sharing the video for this probably today. So if it'll be in your email, you can have a link if you missed anything of interest. And if you have any other questions, you can email info@ehidc.org and we will follow up with you. And with that, thank you for joining us, and everyone have a wonderful day. Thank you. Goodbye.
Thank you.
Thank you.
Thanks.